Hiya. Blimey, quite a warm day. Couldn't get hotter though. I just wanted to take time to record a video, hopefully a fairly quick one. I might have mentioned in one of my other vlogs that I made a formal complaint about my MS team because there's been oversights in my care that have actually led to a lot of pain and suffering, as in physical pain, nerve pain to be precise. You'll probably see that I've talked about nerve pain quite a lot, my experience of it and what I found to help. But anyway, this is about my difficulties with my MS team. So I sent a formal complaint about the fact that they'd missed systemic factors, so my iron wasn't off the bottom of the scale. So they said, well, seems fine to us, but your iron shouldn't be too low when you have MS. It could cause problems. It was definitely worsening my nerve pain, and I couldn't recover while that was the case. Thankfully, I managed to get an appointment with a doctor worth their salt at my local surgery, and she booked me in, managed to get my local hospital to agree to some iron infusions, and I have actually started recovering now. Yesterday I was supposed to have, my complaint was that there were certain systemic factors missed, which meant that my treatment and support for what I was going through, they definitely didn't. However much I expressed it clearly how much pain I was in, they didn't seem to take it seriously. Really frustrating. So, and it's because they weren't taking a holistic approach to my care, so they didn't see the iron as important. But we now know it is really important, but that's a personal thing. Each person is different. So I got my iron infusions. I'm now recovering slowly, but I still deal with pain multiple times a day and during the night, very disturbed nights. And that's a year after this kind of acute attack started happening. Anyway, so I've complained again because I clearly gave the symptoms of trigeminal neuralgia a year ago directly to my MS team and my neurologist. It's called the suicide disease because it's so painful. So basically you're getting pain into the trigeminal nerve in your face, and it has pathways that come from behind your ear, along your jaw, along your cheekbone, to the tip of your nose, I believe into the eye, because God, that's been the worst pain I think, in the eye, across your forehead, plus stabbing pains in my head. So I said this a year ago, and actually things like nortriptyline and amitriptyline are not the right sort of treatment for that kind of pain. They're more for pain that's there all the time. This is what I believe anyway. I'm not a medical professional, so don't quote me on that. It always helps to do your own research. That's what I've found being absolutely crucial for me. But they didn't once offer me specific treatment for that condition. And a year later, I'm still having it, and it's still massively impacting my quality of life. I mean, I've had to give up work. I've had, I feel like I've been failing as a parent to my son. And it's been absolutely awful. Probably the worst 12 months of my life. Definitely the worst 12 months of my life. So I was supposed to be going to have a nerve blocking injection because there is a mechanical trigger, but MS is making the pain worse. And probably, trigeminal neuralgia wouldn't be a classic symptom of a bulging disc in the neck affecting the C6, C7 nerve root. So after a year, I was booked in for it. No, sorry. It's taken a year for them to actually agree to do a nerve root blocker injection. I was going to have it yesterday, got up early, went into the hospital to have it, and the consultant said, I don't think this is the right treatment for you. It's your choice ultimately, but it's unlikely to correct things like trigeminal neuralgia, which is very common in MS, I've learnt. I didn't know that. People don't talk about it much, although there is a Facebook group and it's worth joining because that's quite enlightening. So I decided not to have this nerve blocker injection. I literally had another MRI on my head because I haven't got lesions on my spine, but I've got quite a heavy burden in my brain apparently. So the focus is the brain scan for my monitoring, and I only had it the day before, so they haven't had the results from my latest MRI, and they still wanted to go ahead with the nerve block, and it's just not the right treatment for what I'm experiencing. And the thing that really got me was the risks that it can actually there's a chance it could make my symptoms worse, permanent damage, and there's no way I could possibly take that risk, because however much I think my life is a faint shadow of its former self, that would be another level altogether of misery. So I've now made another complaint about the fact that, so I also had an appointment with my MS nurse on the same day I had my MRI, a phone appointment, and she said, oh yes, well there are ways we can treat trigeminal neuralgia, and she started actually acting, it's the first time she acted like she was aware of this condition, so she'd seen it in other people, and she mentioned some drugs that I could be prescribed, which I haven't been before, even though I made it clear what my symptoms are. I have got the classic symptoms, pain in the hand, pain in the arm, but it actually, what's more debilitating is the sort of referred pain I'm suffering with the trigeminal neuralgia and pain in the head. But yeah, I can't really believe that for the first time, on Wednesday, on the phone, she acknowledged that she knew what this condition was, and that there were treatments available, none of which I'd been made aware of. Anyway, so I'm making another complaint about that. I think it's absolutely terrible. So that's my news, and the fact that I nearly went through with this horrible invasive procedure, even though, thank God I managed to speak to a consultant that was worth his salt. So if I'd had it done and it had caused permanent damage to my nervous system, I could be looking at worse pain for the rest of my life. And they were quite happy to let me go and have it, not having had my latest MRI results. Oh, just catalogue of errors. Anyway, so I've talked long enough. So I'm still I have not once regretted my decision. And, I know now it's up to me. They may offer me some other drugs, but thank God I've been proactive enough to look into my condition and really learn about how it affects me and the things that can alleviate the symptoms. I think that is the key these days with our health service as it is, to be proactive, have autonomy. I know it's not always easy for somebody suffering with MS and all the problems that involves, but you've got to fight. You've got to fight to get the help and support you need, as far as I can tell. I hope other people are having better experiences, but I'm not going to take it lying down, that's for sure. I don't want this. I'm not trying to get compensation or anything. I just would like for this not to happen to other people. So that's why I'm sharing my experiences. And it kind of helps me offload a little bit. Anyway, thanks for listening. Bye.